video, because I don't want it to go off or play for 20 minutes before I can hear anything.
Oh goodness. Oh, I'm dreading starting that car. Oh, what a pain in the butt. What? Sylvia sent me a message.
What did she send you a message for?
I don't know. You're not grown until you know how to communicate. I'm not even freaking opening it.
Usually there's 3, 4, 5 people playing, but I guess nobody's on today. Sylvie's, why ain't anybody playing? Well, you know how many times have I told you that I had a doctor's appointment today and I'm on commission for a little while? I wasn't gonna race again this week, but they changed it to where you can't opt out of the race anymore.
Yeah.
Drink, please. Thank you.
April.
There was a patient already in the room when we walked in. Boy, they made them wait a long time.
Yeah.
And actually, considering I've had no blood pressure medicine, that blood pressure was not that bad. You know?
Yeah.
Mm-hmm.
Yeah. End of days. Appropriately named suckers.
Not now.
Huh?
So not now. Listen to it later.
I'm listening to it now. Wow. It's all about the end times. End of the world's drawing near. Oh my God, it's Armageddon's battleground. End of days. The final blow. The world's aflame as the scriptures.
Hi, how are you?
Good, how are you?
Good. So I looked at your pictures,
Mm-hmm.
and you have what's called a Morgagni hernia.
Morgagni. Okay.
It's probably something you were born with,
Huh.
And so what happens is your diaphragm doesn't fuse in the front, like underneath your breastbone. So the biggest problem with you is your weight. So what kind of trouble have you been having?
Well, all kinds of digestion stuff and swallowing problems and
Okay, so tell me about that.
breathing problems. I don't, sometimes I swallow and things get stuck. And I throw them back up and then I can go back to eating and I'm fine.
Okay. And
A lot of
then,
burning in my stomach. I've been diagnosed with a peptic ulcer, but now I hear.
so how
that
did they
this-
diagnose?
Yeah.
Oh, it was just a.
Did they just go, sound like you have an ulcer?
Yeah,
Okay.
basically.
Have you ever had scopes or anything like that?
Mhm.
Okay. So when you have trouble swallowing, is it worse with solids or liquids or the same?
No, liquids is no problem.
Okay.
Just solids.
When you have, how often does that happen that you have trouble swallowing?
It's weird because it comes in spells, like I may have trouble for a month and then it'll go away for a couple of months and then it comes back and might be there for a week and then it goes away. I have a lot of side pain
On
back
the
in
left
here,
side?
on the left
Okay.
side. And right now I'm very, cause, you know, after the pneumonia, I'm very short of breath. I can walk here to that door and I'll be short of
Yeah.
How long ago did you have pneumonia?
I was diagnosed the day before Mother's Day.
Okay, so back in April.
Yeah.
So when they diagnosed you with pneumonia, how did they diagnose that? They just did
X-ray.
chest
They
X-ray?
did chest X-ray. They said
Did they say it was on your right side down low?
yes.
It's your hernia, you probably didn't have pneumonia. Were you having cough?
Yep.
You
And
had
that's,
fever?
no fever.
You coughing stuff up?
Yep.
Where were you that they diagnosed
I
that?
went to Healthcare One. I didn't know that Mercy had energy care that was up until
No.
8. They told me they
Did
posted
send-
2 that
let me
day.
see if they sent something.
I don't know if they did on the X-ray.
And it's heat, it's like you can't get
Yeah,
to that breath.
I can't catch my breath, yeah. And the heat is horrible.
So here's the thing, ideally to fix these diaphragm hernias, you do better if you get your body mass index under 35. And when I say do better, you have a better chance of things not coming back. You have pretty good sized hernia, that may be what they saw when they said you had pneumonia.
Mm-hmm.
Okay, I do not think this type of hernia is likely causing you any of your troubles with swallowing or stomach pains. Okay, the burning discomfort. So normal, okay, your diaphragm is a muscle that separates your chest from your belly. Okay, so your lungs up here. On the right side, your liver's underneath here. I'm drawing it wrong, but I was kind of think about this.
You didn't take art school?
So your liver sits up there.
Art school wasn't part of your
No,
MD,
I'm not a great artist. So, what happens when we look from the bottom? Normally, you have your like aorta comes through, you have your esophagus comes through, and then you got like your ribs kind of make a round area. Does that make sense? Then your breastbone comes up here, your ribs on the other end. Okay, so normally your diaphragm covers up all this, like we're looking from your feet staring inside.
Okay.
So what happens is you have a defect where this diaphragm did not fuse up here. Okay, so you have a hole in the front of your diaphragm. It's not where your esophagus comes through. It's a different kind of diaphragm hernia.
Will you write, will you write the
We'll
name
write
of
it
it?
down, yeah. And so you have fatty tissue that goes up, and it comes from this front, and it fills up kind of the lower part of your lung, or your chest. So it can cause you some shortness of breath. The problem is, when we start going and fixing that, if you're heavy, then that tends to tear back open and come back. Okay? The other thing is, I don't know that that has anything to do with your trouble swallowing.
What about
Okay.
the back pain, the mid back pain I have?
Probably not.
Okay.
I mean, if it were to go away, I would take credit for it, but So really, ideally, I would want you to lose some weight before I fixed it.
Which is what we've been trying to do,
And
which
you
is
want to do a breast reduction
how
for
they're
the
mo-
back pain, so.
how the ammonia,
That's
pneumonia,
why-
whatever, because
I tried Trulicity, it just made me so sick. I did Ozempic and it's a little better, but not much.
Are you on Ozempic?
Well, I have it, it's on hold because we didn't know about surgery. What
Yeah.
do you recommend?
So I recommend you lose weight.
Well, how do you recommend?
Ozempic, if it works for you. I mean, that's a good way.
I mean, I was li- I- I've
'Cause
lost 12
when I
pounds.
look, you've lost weight. You were 39.5 on your body mass index, and today you're 38.9. So you've lost 4 pounds from June in the last month.
Right.
But if you go on Ozempic and you're losing weight, that will help you. And I think a lot of that will help you with your shortness of breath too, if you can get your weight down.
good Lord, if it's like the other, you feel like hell constantly.
Yeah,
And you're throwing,
I'm
and
sick all the time.
you're throwing up. That's
That's
So,
all-
what.
that's all
and that's what I mean,
we're
I
saying.
don't think the throwing up is this. So that's kind of the question of I think we probably ought to do some things to look at that, okay? Because there's different kinds of there's different kinds of diaphragm hernias. There's also a hiatal hernia where your esophagus and your stomach gets pulled up in your chest. I don't see much of that. But what I would maybe recommend is let's set you up to see the gastroenterologist to do a scope, okay? And then that way, because here's the thing, is they look in your stomach to look for anything like ulcers. That's why I was asking, did they just go, you got an ulcer?
Yeah,
So they're gonna look, see if they see anything like ulcers. They'll look, see if they see anything like hiatal hernia. Okay, they're gonna look in your esophagus, make sure they don't see any growths or tumors or anything narrowed or that could cause you that trouble swallowing. And that also, rather than us going and fixing this hernia that I don't think is causing those swallowing issues, let's look at that before we go do a big surgery. That also gives you time to get on your Ozempic, try to get your weight down. Okay, and you don't have to lose a bunch of weight. Let me figure it out. So, how tall are you?
5'4".
So 5'4". I'm gonna say you probably need to be about 200. But
38 pounds. Oh, good
Well,
Lord.
I'm not too, I'm 226 now, that's 26 pounds.
you do it at 200. See where that puts you. Nope, you don't even have to lose that much. You gotta get to like 204. That'll lose pretty much 20 pounds.
And-
204 is right at 35. Okay. And then, so what we do, basically, the way I do this is I usually, and these are not common, okay? So, I don't think anybody does a whole bunch of them. I've
But you
done
do.
a handful. I don't do a whole bunch of them because they're not common.
Right.
Okay, so what I usually do is I do this with the surgical robot. So we go in and there's your ribs, there's your hips, there's your belly button. We make 1, 2, 3, 4, and 5 incisions. We go in and we pull that stuff down out of your chest, and then we take and we get between the layers. So I try to get between the layer of your belly, so we get in the lining, and then we go and we sew that up. And then what I do is I lay a piece of mesh in here over that to repair it. Okay, and then we take the lining of your belly and sew that back up. But that's the problem, is if your weight is heavy, especially you kind of carry your weight around the middle, there's more tension on it. It's more likely to pop open and come back. And so that's why you gotta have your weight down before we go to fix it. And so what I would do, because you're having that dysphagia, let me send you to see the gastroenterologist, see if I can get him to do an upper scope. Okay? Because I don't want to go in, let's say you had something in your esophagus, like a growth or tumor or a narrowing. I don't want to go in and do a big hernia repair and then have you come back and go, hey, I'm still having trouble swallowing.
Right.
Okay? This may be part of your shortness of breath. Okay?
Okay.
It also,
The
other thing-
diaphragm maybe.
the hernia, yeah,
The
because you
hernia.
have,
Yeah.
come out here and I'll show you.
Okay. I didn't bring this today, but I know I'll look back.
Oh, they should, you guys close it out.
aspirated, or right after you
Yeah.
woke up twice.
Aspiration.
Yeah, that's what she told me
You threw up
up
in your-
there, is that I was on that Trulicity and I was waking up 3 different times, and I had not waking up to throw up, I had thrown up. And she thought that I probably
You
aspirated.
didn't have money, cause yours doesn't show up much there. But this, that's your hernia, okay? So where, so here's your diaphragm, here's your diaphragm on one side, so what you do is you end up seeing hazy stuff, trying to get this. So as you come down, it's like you put your body through a bread slicer, okay?
Right.
So we're standing at your feet, looking at your head, so you start to see your heart, okay? You see this stuff, it looks different, this is your lung, okay? So it's got your lung kind of up out of the way, up in your chest.
Trying to put pressure
Here it
on
is.
them.
You see how it's up in front, and that's not a great view, this is actually a better view. It helps you see better, so this is your breastbone, okay? So you see this is your diaphragm, and the hole in it is up front, this is right under your breastbone. So this is your hole in your diaphragm, okay? And you have fatty tissue going up there. So as we start to go more, now you get a little bit because your heart, but then when you look, normally your lung is all the way down here. So all this stuff, this fatty tissue from the end of your belly, it's up in your chest. So it's taking up, it's not half, but it's maybe a third of your right side of your chest, okay? Now when you look, here's your stomach, okay? And here's your esophagus coming through your, this is where your esophagus comes through your diaphragm. And you may have a little bit of a height on it too. I think you do. So you see diaphragms here, and you have a little bubble of stomach up there. And that may be what's causing some of those symptoms. It's the same as far as the trouble swallowing, and like having that, you're taking the Trulicity again, I was talking about the Trulicity.
Right.
So hiatal hernias usually cause, they can cause trouble swallowing, they can cause heartburn, they can.
Oh, my.
They're really big, can cause, shortness of breath. But you've got what looks to be like a little small hiatal hernia, okay, in addition to this big diaphragm hernia. But this thing, way up here, you see how it's way up in front? It's not putting any pressure on your stomach or your esophagus. So it's not causing that trouble swallowing. It takes up half your, it takes up a third of your right chest, so it can make you short breath. And so you gotta get your weight down so that when I pull that out, so if I get it, it doesn't fall apart. The other thing is the same thing with the hiatal hernia. We can fix those, but if we do, you're not a candidate for hiatal hernia unless your body mass index is below 35 for the same reasons. It's a fall apart. Also, if you lose weight, you can have improvement in your blood swallowing. So, yeah, if you're having a lot of trouble swallowing, it doesn't look like that. Let's have them do a scope and kind of look at all that stuff.
They'll figure out why I have it sometimes and why
Well,
sometimes I
and
have
then
it.
sometimes it's just maybe what you're eating, big bites or something like that.
Yeah, and big bites don't help.
Yeah, and the acid, lately, you can't take a drink of anything, citrus or whatever.
Oh, yeah, citrus, I love citrus, I
And
can't do
you
much.
take any acid reduction medicine.
I have Protestant.
Okay. So what I would suggest is you gotta come up with some way, whether it's the Ozempic to lose weight, or restricting the diet and walking.
She said you didn't.
I'm
Yeah,
pretty
she
much
can walk.
immobile.
Lose weight, we fix your hernia. Okay, so you gotta come up with a way to lose weight, and fix the hernia.
So if we fix the hernia, am I in the hospital for a couple of days, or overnight, or
Maybe overnight, depends on
outpatient?
what we do, and that's what it depends on what, like, if I do the hiatal hernia along with it, then usually I keep you overnight. If I'm just able to do that, I'm able to do it through all the little incisions, I would probably let you go home with from that more gagging hernia. So,
Organic, yeah.
yeah. So,
Research it.
and that's what I was telling you, there's different kinds of diaphragm hernias. So when they come up and say, hey, you have the right side of the diaphragm hernia, what I need to know is if one of those that comes in the center, the other one's called locula, and it happens above your liver. The problem is I do abdominal surgery, I cannot get to it because your liver's in the way. So if you have a locula hernia, then it comes to your chest and fix it. Okay, you have more gagging. I can get to it, those are the kind of, that and hiatal hernias, I do those. Okay?
Thank you.
That's what.
So I just go and you recommend a scope, I have
So
that
I'm
done.
recommend a scope, I want you to come back and see me after you get your scope, okay? I'll Who gives you your exempt?
Melanie Thompson.
Talk to her about starting back on that. Okay, I know you're having John's long neck, I think, but start on your Ozempic, what's Nancy may do, and hopefully that'll give us a little time to see how they feel. Okay, now the other option, if you can't lose weight, I'm talking about sending you to see geriatrics or weight loss surgery. Now the question is, currently we don't have anybody at Mercy that does that, so I could send you to see somebody, and maybe one of us is maybe we're going to come in and do something combined with doing the diaphragm hernia at the same time. But it's not
Breast
typical.
reduction at the same time, so I just don't,
But that's what it
go
is.
under
Typically, you gotta lose the weight before I'm gonna do that, because what happens is it just comes back. You know, I can take your money and go repair it, but if it fails, you're gonna do that. Okay, and that's why you gotta get your weight down. Okay? But I'll send you to the gastroenterologist, and then you know when your scope's gonna be, you turn around, make an appointment, come back and see me for a week or so after your scope. Okay, because we wanna look at those results and see what that shows, and that gives us a little bit more information about what I think is a little high on too. Okay? All right. You're welcome. You're welcome.
God bless.
Thank you. You guys have a good course.
All right, thank you,
Go ahead,
you too.
get her stuff.
Yeah, yeah. You want this water?
Well, take the last drink, might even put some in it. On the way down.
Oh. Duh. Jesus.
All right.
No,
I'll
you're
kiss you.
fine.
All right.